All right, guys, happy holidays, and thank you for joining us on Power Play Tuesday with Quest Trust Company. My name is Freeman White, and I'm an IRA specialist. And let's just go ahead and jump into things. Okay. All right. Just for starters, just like to point out that Quest Trust Company does not provide legal investment or structuring advice or endorse any products, services, or investments of any type. Um, we are strictly doing this for educational, um, one moment, sorry guys, educational purposes. All right, so if you guys have any questions on self-directed IRAs or would like to schedule a consultation today or at any time based upon any information that you hear today, feel free to scan this QR code and speak with a IRA specialist here, such as myself or any of the other IRA specialists via this QR code here in the link, and we'll repost this again. Okay. We've got a couple events going on later on this year in 2024. We've got the Quest Expo. It's going to be June 27th through the 29th, and right outside the Dallas area in Irvington Convention Center. We're going to have various individuals with expertise speaking on navigating alternative investments and everything self-directed. So if you're interested, please also scan this QR code to purchase tickets. Early bird tickets will be ending shortly. And the last thing I'd like to kind of bring up for you guys today is our current promo. We've got a new promo beginning of 2024. Right now, we're offering $50 off your account opening fee for new money and new accounts at Quest Trust Company. Just type in the QR code or the code new 24 on your applications. And then lastly, going to get into the thick of things today. We've got uh, Dr. Tisha Rowe. She's a healthcare professional with tremendous amount of knowledge on many ways to invest in healthcare. Going to just let her get to it right now.
Hi, everyone. Very nice to meet you. I am Dr. Tisha Rowe coming to you from Houston, Texas, and I am very excited to speak to you today about healthcare investment strategies. So just to kick us off, I would like to tell you a little bit about myself and where my knowledge and experience comes from. I am a family medicine doctor. I trained at Temple University in Philadelphia. I then ended up in Houston to pursue my residency at Baylor College of Medicine. While in residency, I also obtained an MBA. It was actually a joint program where you came into residency knowing that you would be getting an MBA. And then I went on to, in 2014, upon completion of residency, start a telemedicine company. Now, post COVID, I'm sure everyone knows about telemedicine, but at that time, I really was an early adopter and was able to scale the company to close to 100 doctors internationally. We had doctors in Turkey, China, West Africa, the Caribbean, and here in America. And through that journey, it allowed me um, to participate in many different sectors. So, not just healthcare, but also technology, and see different sides of healthcare that I was not exposed to simply by training to become a physician. Throughout my startup journey as a founder, I raised over $1 million, which may seem like a small number if you're familiar with venture capital. But actually, when you look at the amount of capital that goes to women, it was a substantial effort. So through that, I got to meet a lot of investors, learn about the questions investors have, the things that investors want to do, are looking for, and was able to, give people advice. And as they said in disclaimer, we're not giving you investment advice, but just to open your eyes to all of the possibilities out there in healthcare. I would say the number one thing I would hear from potential investors is your pitch was great, your deck was perfect, but I don't understand healthcare enough to invest in it. And I hate to see people miss out on that opportunity because of a lack of knowledge. So my goal here today is to share with you, impart with you the knowledge that I've obtained as a practicing physician and entrepreneur and founder, and what I see from my perspective as the opportunities for investments in healthcare. Please feel free to use the chat if you have comments throughout the presentation. It's okay to interrupt and let me know what questions you have, and I will be happy to answer throughout the chat. And I'm not sure, I do see companies from the host. So if for any reason I'm not able to see the questions, host, if you can share those with me in the private chat. So let's get right into the meat of it. What do I think as a physician entrepreneur are the best opportunities today to invest in healthcare? Absolutely not all inclusive, but definitely these are the opportunities that I'm going to review and share with you why I think these are great opportunities to invest in healthcare. We're going to jump right in with technology. Then I'm going to talk a little bit about real estate investing specific to healthcare, medical devices, as well as healthcare apparel, and last but not least, pharmaceuticals, and why I think that's a really hot opportunity. So kicking it off with healthcare, unless you are literally under a rock, you know that AI is all of the rave right now, not just healthcare, but everywhere. Everyone is talking about artificial intelligence. Well, when it comes to healthcare, AI is going to be huge. And I'll tell you why. Healthcare is absolutely, having practiced for 10 years, one of the most inefficient industries there is. We don't move and we don't change unless we absolutely have to. And a great example of that for you would be telemedicine. As I mentioned, I started doing telemedicine in 2014. It just made sense. Why am I going to the office and the patient coming into the office every day if we have virtual meetings, we have all the technology, all the capabilities, but healthcare refused to adopt telemedicine until through a pandemic, we were forced, and now telemedicine is the rave. That is just one example of our inefficiencies. I can tell you as a practicing physician, there are many more. And what we're seeing now with AI, artificial intelligence, is that there's a lot of opportunity to improve the way we deliver care and also decrease the administrative burden on physicians. A lot of physicians have started walking away from medicine because they're tired of the documentation, say paperwork because it's digital. They're tired of the prior authorizations. They're tired of the refill requests. So what can we do about that? We can implement AI. Now, when it comes to implementing AI in healthcare, it gets a little tricky because we do have HIPAA. We have to make sure that we're protecting privacy. And we also want to protect the doctor-patient relationship and the personal side of medicine. So how do we implement and introduce AI in healthcare without taking away that personal touch? So in 2021, artificial intelligence healthcare alone was 11 billion US worldwide. And it's forecast that the AR market is going to be 188 million. You can see that is a tenfold increase within less than 10 years, right? Annual growth rate of 37% from 2022 to 2030. So if those are the type of returns that you're hoping to get, then absolutely AI, I think, is the number one opportunity to invest in healthcare today. But here's the challenge. who do you invest in and why? So this is just general, very general information on things. If you see opportunities, what you should look for when investing in artificial intelligence in healthcare. So find companies that focus on identifying the pain points of physicians. Physicians are absolutely the drivers of revenue in healthcare. And if you can find companies that recognize, find the problems that physicians are having and fix them, then you are looking at the right companies. And just for your knowledge, not if you're not a physician and you're thinking, well, how do I know what are the pain points of physicians? I'll share with you as a physician some of my pain points. Prescription refills. In addition to seeing patients every single day, I get about 20 to 50 refill requests every day. Some of them can be approved, some of them can be denied. Practicing today, I have to review every single refill. If there are artificial intelligence apps that focus on refill requests, that's going to be a great opportunity to improve healthcare. Physician documentation. In order to get paid through insurance companies, it doesn't apply to cash pay. You have to have specific parts of documentation included, and that determines how much money you make. Many physicians do not document everything they do. Therefore, they lose out on potential revenue, which leads to the physician feeling undercompensated, dissatisfied, and burned out. There are actually AI apps now that the physician can bring into the room. It records the entire conversation and documents it. So now nothing is missed. There are pros and cons of that. Physicians, although that sounds great in theory, may not want to adopt that for liability purposes. They may say, will this be used against me in the long run? So not everything that is a great idea will necessarily be adopted. And you have to think about why that may be. Medical billing, artificial intelligence will also be very important. There are a lot of times where doctors are not getting paid because someone didn't pick up that they did certain things. And I'll give you examples. A doctor does the EKG in the office. If the billing company bills the visit and not the EKG, that's revenue loss that adds up really quickly. So any application that can potentially increase the bottom line of the physician will likely be adopted not only by individual physicians, but large groups, and will do very well in the long run. Also, any healthcare AI apps that improve the physician-patient interaction. And what do I mean by that? If my patient wants to contact me outside of a doctor's visit, they have to call the office, email the office, or text the office. And there's a delay in the time that their message will get to me, which leads to a lot of patient frustration. If there's a way for patients to be able to communicate with doctors more easily and with boundaries, right? No doctor wants to be contacted by patients all of the time. That would also be a great opportunity. So these are some of the pain points of physicians that I think healthcare AI apps will be able to address and will do very well. Now, here's the challenge, right? Once you have identified, here's a great app, they understand the pain points of physicians. What you find is a lot of apps focus on only one thing. So what you get are 5 different companies trying to solve 5 different problems, and the physician does not want to have to learn and use 5 different apps. So if you can find one that solves all of these problems, that's the best opportunity. Oftentimes we're getting pitched to for many different things, and the problem is you can't implement all of those things. So once you know that they have identified a problem, explore how the app solves the problems. I've had calls with AI apps. And I'm like, that's great that you see that as a problem, but the way you are solving the problem does not work for me. Speak directly to end users, end user being the physician. Anyone can pitch you that an app is great, it's going to be the best thing. You need to hear that from multiple doctors that they're in agreement. Otherwise, don't believe the hype. And last but not least, it can be the best app. Every doctor can love it. If it does not integrate with the large EMRs, they can only go so far. Some of the biggest electronic medical records in healthcare are Epic and Athena. So if you have an amazing app, but they were like, we are going to get an agreement with this EMR, I would say, hey, tell them, come back to me when you have that agreement in place, because these are electronic medical records with 100,000 plus users. And if you can't get to 100 plus users, it's going to be very challenging to scale, because most doctors are employed and do not have control over what they implement in their practice, if that's the case, even if they're even if they're in private practice, but working with an independent practice association. So those are my tips on healthcare AI apps. I did a little research. I'm just throwing these out there. You are doing your own due diligence. I have zero connection, relationship, or investment in any of these companies. This is just what, through my research, I saw are some apps, and I'll give examples of what they do. Suki is an app that I mentioned that does the scribing for the doctor, meaning instead of me hiring an individual scribe, they are a virtual scribe that then creates that note. So they are solving the problem of medical documentation. And number two, Deep Scribe, as the name says, does the same thing. I also mentioned healthcare engagement. TalkDesk is one application using AI to improve healthcare patient engagement. Ada AI is an AI doctor. And I really wanted to put this in there because whether we like it or not, the ultimate goal of AI, I believe, will be to decrease the number of patient encounters we need, which will also decrease the number of doctors we need. So don't be shocked or surprised if you see applications promoting, we're going to just take all your symptoms, put it in an algorithm, and tell you what we need. And they'll have one doctor signing off on 1,000 patients using an algorithm. As a provider, do I like the idea of that? No, I think important things will be missed. But do I think that regardless of how I feel about it individually, will it be adopted? I absolutely think it will. Okay. And last is Sensely, a virtual nursing assistant. I think most doctors will tell you good help is hard to find, and having an amazing virtual assistant, even if that was an AI assistant, would be really good. But you would want to know that that is something I wouldn't invest in something like this unless it was in the user phase, and you can see that it's not like, for instance, the Facebook help desk that's going to just give you the same information over and over and you get nowhere. All right. And I don't see any questions in the chat now, so I will move on to my second opportunity. One that excites me the most is healthcare real estate. And so this slide just kind of gives you an overview of the opportunities. Now with telemedicine, you won't say every doctor physically needs a place to practice, but every doctor that accepts insurance needs a physical address. So that doctor can be doing telemedicine at home. That's great, but insurance companies will not credential you without a physical address. So currently, or as of the last few years, there were roughly 36,000 properties utilized for healthcare. There are 1 million doctors in the United States. And so when you think about that, the healthcare real estate market is by itself a multi-billion-dollar industry. So I think when it comes to investment opportunities, investing in healthcare real estate is one of the best opportunities because, and I'm saying this as a physician, physicians don't want to move, right? Once I establish a location, I maintain those relationships with my patients. I want to stay for 5 to 10 years, unless things really aren't going the way I hope. If you have a healthcare client, you're in a good place. Um, Going forward, I think what you will see more and more of is medical co-working spaces. And what medical co-working is, where doctors are now, instead of renting an individual unit in a medical office building, you have like a WeWork where multiple doctors can rent just one room, one day, and utilize that space as needed. These are just some examples of medical co-working spaces around the country. Um, when it comes to medical co-working, what you want to look out for is what is going to make them unique and why would a doctor want to practice there instead of practicing on their own. Some of the factors which are outlined in this slide that doctors may take into consideration and factor in is the monthly costs, right? Healthcare, the margins have become smaller and smaller as insurance companies try to squeeze doctors. With that being said, price is going to be a huge factor. Then, what's included? Are they also offering billing for the doctors? Are they offering marketing for the doctors? Are they offering any practice management? Because most doctors don't go to business school. Most doctors don't know how to run a practice. And many will not go into private practice simply because of the fear of not being able to run that business. So, unlike most co working industries where you're really just focused on providing a space for entrepreneur, when it comes to healthcare co working, you really have to look at giving that entrepreneur more than just space. And so, this kind of gives you an idea of the pricing and different services that some healthcare co working spaces are offering around the country. And I do, with disclosure, own a medical co-working space. And the financial opportunity, I didn't do this for all industries, but because it's something that I am actively engaged in, I do have that number, these numbers. This is what you can look at revenue-wise from co-working spaces, depending on the number of doctors or units that you have. So like any other real estate, the more tenants, the more money that you can make, and the higher the valuation of that business will be. And I don't see any other questions in the chat for here. So I will move on to opportunity number 3, which is medical devices. And I'm going to focus on, there are lots of different applications involved in healthcare, but today I just want to highlight one opportunity that I think is going to experience significant growth in the near future, and that's remote patient monitoring. If you're not familiar with remote patient monitoring, insurance companies are now paying for patients' blood pressure machines and glucose monitors. We have roughly 30 million diabetics in the United States. Many of those people also have diabetes. So now, with insurance companies paying for those devices, you're seeing a significant growth in this device market. So it's anticipated that is going to be up to 760 million by 2030, with a growth rate of 3.3%. You can see that's much lower than the AI growth predictions of 30%, but it's still a good growth period, right? And I do think that if you find the right companies that investing in remote patient monitoring is a big opportunity in healthcare. I think there will be a few companies that dominate the industry, and the key will be finding those companies. So how it works, the physician has to order the machine. So if you're evaluating investment opportunities, I would want to ask, how many physicians do you actively have using your products, and what is your plan for growth, and how do you plan to recruit additional physicians going forward? After the physician orders, then the devices are deployed. Questions you may want to ask if exploring opportunity is, what is your turnaround time between acquiring devices and deploying those devices? And also, do you have a reliable supplier that if this business scales, you'll be able to meet the demand? Once the device is deployed, the patient is then monitored by a third party. And that third party is responsible for giving feedback to the physician. And you will want to know what type of clinicians they're using to do that monitoring. Are there medical assistants or nurses? What is the knowledge level? A red flag for me with a company would be if they have non-licensed professionals. And again, even a medical assistant is a licensed professional reviewing that information. Once that information is received, if they see any abnormal numbers, they then send that over to the physician to review. And the physician can get paid every month by month for every patient who has this machine. And so it's a very attractive business model for physicians because, again, back to the beginning and artificial intelligence, their physicians are looking for opportunities to increase their bottom line, to decrease burnout, and to work more efficiently. Going back into the chat. And I don't see any questions there. So going on to the next opportunity, apparel. So here I am wearing scrubs like most doctors do every day at work. And once upon a time, no one cared, right? Doctors just wore whatever scrubs we could find, usually standard blue scrubs. Now we are in an age of scrubs and fashion. And so investing in healthcare apparel, I think, is a great opportunity. The global medical clothing market was valued at $42 billion in 2021 and is expected to double to 96.4 by 2031. One company in particular, you've probably heard of them. Again, I have no investment or stake in any of these companies. Figs. Net revenue was 144.9 million, increase of 12.6 million, right? This is just one company. There are other companies out there like Figs that are potential investment opportunities. I think what you will see in the future with healthcare apparel is different companies focusing more on the functionality of scrubs, right? Doctors are going from work to the gym. So I think one great opportunity is going to be things that where scrubs are not just for work anymore. And you also see scrubs being used outside of medical, right? You have massage therapists, nail technicians, many different companies now using scrubs outside of healthcare. So the gross margin for Figs was 68.2%, which was a decrease, but overall still great gross margin, right? So I think healthcare apparel is one of the next big things. And the last, but not least by any means, opportunity that I recommend for building wealth through health is the pharmaceutical industry. And this is going to be no surprise to anyone who's turned on the TV in the last few days. GLP-1 like molecules are now the big thing. And you're like, what is that? It's Wegovy, it's Ozempic, it's semaglutide, it's all of the weight loss drugs that are now all the rave. One of the biggest producers of GLP-1 medications is Novo Nordisk, that revealed it had its best-selling weight loss drug made 3.1 billion last year. This represents a growth of 490%. So we said 3%, 30%. Did this I think is truly, I said AI is one of the biggest long-term opportunities, but if you want I believe if you want something that is a fast return, pharmaceuticals really and the GLP inhibitors are one of the best ways to go. And so that is what I have for today, in terms of 5 opportunities to invest and build wealth through health. I'm Dr. Tisha Rowe, and I am open to any questions. And if you would like to connect with me, I am on LinkedIn as well.
Thank you, Dr. Rowe. I actually have a question for you
Yes.
myself.
Okay.
Can you speak to just you're in the industry? Can you speak to or for people that are not in the industry? How do they spot these red flags? How do they seek these investment opportunities to see, current problems or solutions for these doctors? Because we see the news, we see all this information. What would you recommend would be a good starting place for just research and just kind of seeing things, because we're not in the office like you know?
Correct. So I will be honest. I will say that if you're going to invest in healthcare, now the exception will be real estate. You don't need anyone to give you feedback on real estate. You can look and see, what cities have a need, where there are a lot of doctors. That may be the best opportunities for healthcare real estate. But all of the other industries, if you decide that you're going to dive into this area, networking with doctors, I think, is so important. Doctors will not be the founders. They will not be the ones running these companies, but they will be the end users. So I think attending conferences like Health Conference, huge conference, 5,000 attendees, meeting not just any doctors, but doctors who are business minded and actually involved in these industries. And those are the people that are going to break away from practice and go to conferences like Health, go to conferences like HIMSS. You don't need to go to conferences where we're learning about medical information. Those are not the people you want to connect with. You want to connect with doctors who are really engaged on the investing side. And then don't be afraid to say, hey, what are your thoughts on this? And that can be just on a very informal level, or if you're going to make a sizable investment, you may even want to hire a doctor as a consultant and say, hey, I'll give you $250 for an hour of your time. I want you to test this app and tell me what you think about it. And that 250 may save you 250,000 when things you didn't think of, and the doctor's like, no way, rewind to when I first started and I was doing telemedicine. I had an investor, I had a telemedicine company, but he would ask me to review telemedicine apps. And he actually had me sit in on a pitch. And it was very clear that company was not following any kind of HIPAA protocols. And they actually were from outside the United States. And I said, well, what about HIPAA? And they're like, what's that? Run. Right? Because here they are trying to launch a product in the United States, but they had not reviewed the legal and compliance here in the United States. And that alone, one HIPAA violation will cause you $1 million. So you want to know that compliance is there, and it's something you may not see or realize, but having a doctor test that out. So I would say network with doctors at healthcare conferences and healthcare business conferences specifically, build those relationships and don't be afraid to ask them to take a look and give you their direct feedback. But absolutely, there's so many opportunities, and I would encourage everyone, when you look at America's GDP, right? Healthcare is the top. Trillions of dollars are being spent every single year. And it's a conversation I have with doctors all the time. Like, if you're using it, someone is probably going to take that company public eventually. Pay attention. And that's
Okay.
another way is to ask doctors, what are you actually using in your office? Like, I currently use Athena as my EMR, right? 20 years ago, probably 25 now, Athena was a company started by two individuals. Now it's $1 billion company, right? They built traction, built many users. So when you ask doctors, hey, are you using any AI? What are you using? What do you think about that? Okay, those are the companies that you want to pay attention to, the ones that people are using and like enough to want to endorse it.
Okay. Okay. Thank you. I got one more question for you though.
Okay.
As far as the opportunities, like I guess, like you have investing in, what was that like healthcare leasing space? Is that what you would call
Co-working.
that? Yeah.
Yes,
Can you speak to that and how you got into that and maybe a little bit more about the
absolutely.
opportunities that you see arising, um, you know, in cities
Absolutely.
of great medical, business magnitude?
Absolutely. So I when I went to business school, I never forget in my entrepreneurship class, my professor said, if you're going to start a business, find a problem and solve it. And I identified that my colleagues were going into private practice and closing within 2 years. And they were good doctors. And I was thinking, okay, everyone can't be such a bad business person that they don't last more than 2 years out there. It's an extremely competitive space. However, I thought, started talking to doctors, what's going on? Like, why are you closing? The problem was always overhead. My overhead's too high. I can't afford it. And so when you first start out, you're seeing maybe 2, 3 patients a day. But you've now rented a space so that you can grow into it. And I said, well, what if instead of each doctor using this space every day, why can't they share it? Why couldn't you have 5 doctors in that space? And I tell the doctors I talk to, a good co-working space should want you to outgrow them, because you're going to get so busy eventually. You may want your own space unless you're a stay-at-home mom, or you have doctors on disability, you have doctors that love medicine but have no desire to ever work full-time again. Those doctors may just want a room for a day, but they're not going to pay for a full practice. So that answers your question about how I got into it. And then knowing what I did and seeing what I did about doctors not being able to afford to stay in practice, I said, you know what? I'm going to acquire a space and lease out rooms. But then having the business background, I didn't want it to be just a medical office building. So I branded it and called it Honeycomb. And, you're part of the hive. And I made it something that was fun and innovative that people wanted to be a part of. One of the things when I said when it came to co-working is you have to be different. So if I'm not offering you anything except the same thing that the medical office building down the road is offering, why practice here versus there? So we really focused on creating a culture of, this is where the entrepreneurs are. This is where the innovation is. This is something you want to be a part of, but it's also practical and something you need. When I started my co-working space, there were only 3 others in the United States and 1 in Canada. Now you're seeing more and more more and more co-working spaces. And I believe one of the biggest drivers is COVID, right? When COVID hit, everyone went online to telemedicine. A lot of these healthcare companies had 10-year leases with space. The doctors aren't there, right? The patients don't want to be there. The patients want to see the doctors from their home. So now these big companies are saying, okay, well, do we really need to rent this huge office building downtown? Do we really need to have this huge space? Or could we just be renting a room here, a room there? And that, I think, is where co-working is evolving and really is going to be the next big thing. And also, a lot of doctors are choosing freedom, even if it means less money, because as we see in every industry, not just healthcare, sometimes the bigger the company, the more toxic the work environment. And they're tired of getting beat up. They're tired of getting asked to see 50 to 100 patients per day. I mean, I know urgent cares where doctors were seeing 200 patients a day, right? It's just not sustainable. And people are saying, I've got to get out of this hellhole. How do I do it? Oh, I can get a place where I just pay 250 to rent a space for a day. I'm out of here, right? So the same way we see people fleeing other industries because these industries have failed to adjust to new generations. New generations of doctors are not going to be that old school. I'm going to work 80 hours a week until I retire. And no, they're choosing themselves. And co working is going to offer them that freedom and flexibility to say, hey, if you want to be in Bali and come to America like 1 week out of the month, you can do that, doc, right? This space is here when you need it. So that's really how I got into it. And what I've seen the growth around the country, it is definitely becoming the next big thing. And also that real estate is always a solid investment. So I think it's a great opportunity.
Yeah, so you're saying ultimately doctors coming in or fresh or looking to downsize can start up and kind of grow at a sustainable rate instead of like going all in. Are there
Correct.
different, how can investors invest in Honeycomb or some of these other companies that offer these solutions to doctors? What are
Absolutely. Absolutely. I think the key is finding them in that startup phase. We definitely are in the startup phase right now and accepting investors and really looking at what are the goals of the company. Our goal is to expand nationally and then eventually internationally and then go for IPO in the next 10 years, if not sooner. So if you find a company that you see the vision, you like the team, and you are also going to be able to be a value add, right? There's so many investors that have a ton of healthcare experience, no, I'm sorry, a ton of real estate experience that really can come into an industry like healthcare co-working and partner with the doctor and 10x that vision because they have that healthcare experience or because they've invested in healthcare before. So I'm available for anyone that wants to connect and learn more about Honeycomb. But definitely, I think finding young companies, and I cannot emphasize enough, you have to have doctors on that leadership team because if you get a big fancy space and doctors are not going to go there, your money is going down the drain. And I see that all the time where people start companies and they come to me and they're like, Dr. Rowe, can you refer doctors? No, I need them for my company. And so make sure that you're not investing in companies that don't think about where they're getting the doctors from until the very end. Because a lot of healthcare companies sink because of that. They're like, this is great, but you don't have a network of doctors. You don't have any doctors that can go and plug your company in these healthcare conferences, in these healthcare groups. And when that piece is missing, that can make or break the company.
Awesome, awesome. Well, thanks for answering those questions.
No problem.
Yeah, and thanks for joining us today for Power Play Tuesday. How can people get a hold of you if they need to?
Absolutely.
What's a web
So
address?
you shared my LinkedIn, and our Honeycomb website is the honeycombclinic.com.
Okay.
And very excited to share. We just launched our app, which is available in the Apple Store and soon will be in Google Play. And there's actually a link in that app for investors where they can register and see our deck. It's for patients, it's for investors, it's for people who just want to donors support the vision or follow what's going on with Honeycomb. So best way to reach me will be through that app or messaging me through our website.
Perfect, perfect. Well, I think this about wraps up our Power Play Tuesday. Thank you again, Dr. Rowe. And for anyone else, if you guys have any questions on maybe investing or using your IRA to invest in companies like Honeycomb or other companies that are investing in the medical space, feel free to touch base with an IRA specialist here at Quest. You can scan this QR code and we'd be happy to speak with you. But if nothing else, happy holidays, and you guys enjoy the rest of your day.
Thank you so much for having me.
You're welcome. Take care. Bye, guys.